Good afternoon, everyone. Happy Friday. Thank you, everyone, for joining the Ohio AAP training. I wanted to take the time to thank the Ohio Department of Health for their support with this preventative health program. We have 3 trainings left, including this one for the webinars of the month. So we are excited to have Dr. Denise Warwick speak today. Just a few housekeeping items before we get started. Please keep your lines muted and your videos off. And for the next training that we have is on implicit bias. And if you have registered for this training or would like to register for this training, I would like to note that we had to change the date. So it is now September 29th at 1 p.m. So please check our website and let me know if you have any questions. We have resources available for these trainings and also in Spanish. And here's a list of all of those trainings. There's 1 CME and 1 MOC credit available for this training. For the Quality Improvement Project, it kicks off in December. It is a 9-month QI project. There is a incentive for each practice that participates, as well as free resources, action period calls with content experts, and you get to choose your path and pick 2 screening tools that you will measure. And I have more information on that with a flyer. So if you're interested in that, please indicate that in the post survey that I send out. And for the post survey evaluation, it will be sent out on Monday. Please complete this and include constructive feedback and also complete the 90-day action plan. You're able to take what you learned and implement it into your practice. There will be a 90-day follow-up survey, and please complete any surveys that you've attended for previous trainings as well. And now I will go ahead and pass it over to Dr. Denise Warwick, and we will get started learning about screening tools. If there's any questions throughout the training, please put those in the chat box, and Dr. Warwick will answer those at the end, unless it's super relevant, and then we will slide it in during the training. We're very flexible, so please let us know if there's any questions in the chat box, and we're excited to get started.
Great, thanks everybody, and thank you, Alex. So for my disclaimer, I have no personal or financial relationships in any commercial interest related to this CME, and I don't plan to reference off-label or unapproved uses of drugs or devices. So our objectives for today is to understand the difference between developmental monitoring and developmental screening, to identify when to use specific screening tools with families, and to screen and provide appropriate resources when needed. So our agenda is going to be to overview some of the following screening tools and examples. So we're going to look at developmental screening with some ASQ and MCHATs. We're going to do social determinants of health screening / injury screening, as well as immunization, teen depression, maternal depression, and oral health screening. So what is the difference between developmental monitoring versus developmental screening? So developmental monitoring is the process of recognizing children who might be at risk for developmental delays. And per the AAP, this should be a part of every well-child preventative care visit. And I'm sure we're very familiar with doing this, and this isn't anyone's first time doing this, but I think it's important to recognize the difference between the monitoring and the actual developmental screening. So when we talk about developmental screening, we're talking about more standardized tools that we use to do screening at certain age intervals. So the AAP recommends specific developmental and behavioral screening for all kids at regular child well visits at 9, 18, and 30 months, as well as autism screening at 18 months and 24 months. So next slide. So we're probably most familiar with the traditional ages and stages questionnaire, or the ASQ questionnaire. So go ahead, Alex, I'm going to show you. You guys probably could see these in your sleep. So this is the first page. You see kind of it's has several different questions in each content area: communication, gross motor, fine motor, as well as personal, social, and then and the last one is problem solving. So, and you can see the scoring sheet there. And so as you know, the black shaded areas are areas that we have concern. The gray shaded areas are ones that are borderline, and the whites are ones that are normal, and the child will pass. I'm sure you guys have noticed in kind of using this tool in the past that the questions are very specific, with the goal being is to really fine tune our developmental screening for this child. However, some of the questions are a little bit challenging, meaning, there's one where, does your baby put the, a small task or a small object in a bottle and try to get it back out? And oftentimes I'm in the office and parents say, well, I don't think that's really safe to give my child. And I say, I understand if you don't really know or you've not tried those things, it's okay to skip those specific questions. But so one of the strengths of the tool is that it's very specific. One of the drawbacks of the tool, it is lengthy. So I would say for most parents to fill it out, not being distracted, is somewhere between 5 to 10 minutes. However, if their toddler is running around the room, it does add some additional time to accomplish the questionnaire. So next slide. So there's other options for developmental screening, and I know some other offices have gone to using this. So the SWYC, and I've heard it abbreviated as SWIC, as well as the BPSC, the Baby Pediatric Symptom Checklist. So go ahead, Alex, we can put up a picture of that. So that's the SWIC tool. As you can see, it addresses some of the developmental milestones, as you can see in the top box. And the bottom box also too goes through like a baby pediatric symptom checklist, as far as kind of adjustment and the temperament of the child. So next animation. Okay, so what you can see here is some additional questions about like social determinants of health. So one advantage of this particular developmental screening tool is that it does have an additional area that looks at social determinants of health. So within one concise developmental screening tool, you can look at both things, both development as well as any risk factors in the house for any adverse child experiences. Next slide. Oh, and so here's the screening, or the scoring, excuse me. So some of us that have not used this tool a lot, it takes a little while to get used to the scoring, much like we probably had to practice scoring the ASQ at some point. But you can see that's different depending on age. And then also it gives you kind of your score where, needs review or meeting expectations. And that's different depending on the age of the child. Again, these exist and they're free use online. They're from Yale University, and you can go and search these and peruse. They're available for all different ages. But again, most offices that I've seen are again implementing them with the 9, 18, and 30 months. Next slide. So here we come back to the pros and cons and some examples. So I mentioned the ASQ questions are very specific, but also can be tricky. So, in each of the questionnaires, these are the ones that I've had most puzzled looks about. So the 9-month questionnaire saying, does your baby poke at an object inside a clear bottle? At 18 months, it says there goes that object in a small, or again, that they're looking at the small clear bottle again. And then at 30 months, some parents, when they ask the questions about beads on a string, some parents have not used that, given that they think it's not safe from a choking hazard standpoint. So again, so the pros and cons, it's a very complete questionnaire, but again, some of the questions may be a little bit challenging for families. The advantage of the SWIC and the BPSC are that it's more concise, and that it also has those social determinants of health questions. Next slide. So here comes our tried and true MCHAT-R. So again, I think most of us are familiar with this questionnaire. Thankfully, it is a pretty quick questionnaire to go through. It asks very specific questions to get at if the child is exhibiting any behaviors consistent with autism or autism spectrum disorder. Some kids that have speech delay, I've seen have scored high on this as well. And again, your goal is to screen them at the 18-month visit and then kind of monitor for any interval change at the 24-month visit. So those kids that may be experiencing some speech delay may screen positive, and then as they continue to develop and advance in their speech skills, a lot of times this questionnaire becomes normal again. So Alex, you can put up the scoring for this one as well. I know you guys are familiar and have seen this all the time. Could do questions 2, 5, and 12 being the ones that you're expecting to be no. You probably can do this in your sleep. But I think it is important to know kind of what low, moderate, and high risk is. So if you're seeing that the score is abnormal in 0 to 2 of the questions, that's low risk. And again, no follow-up. Again, if you're seeing 3 to 7 as scoring off on this questionnaire, it's moderate. And we do repeat that screening again at 24 months. And then the score 8 to 20 is high risk. And I think you should, as suggested here, follow up with early intervention or developmental or behavioral pediatrics at that point. So next slide. So that covers most of developmental screening and developmental monitoring. We're going to move on to social determinants of health. And I saw one question that came through the chat box too about kind of expert on these screening tools and advice, tips, and tricks. I can't say that I am a content expert on these specifically, but I do think that, I have a lot of experience using these in the office. And I think, our office went through kind of a revamp too, to look through what is the most concise, but also accurate way to do these questionnaires. And so that's why we looked into multiple of these tools. I think everyone has a preference based on their experience of what they've used. But these are some of the most common that we've seen across, several practices across the state that have used these and people that have the most comfort with them, as well as what's readily available. So as far as social determinants of health, these are the things that we're looking at to see about things that may jeopardize, children, may put them at risk for maltreatment, also be affecting for their development and their safety. So specifically, we're looking at parental depression, substance use, major parental stress, any intimate partner or domestic violence, food insecurity, and harsh punishment. And I'm going to put a big caveat on, when we do talk about social determinants of health, I think it is wise to screen for this often. However, I also think it is equally as important to know and have knowledge in your area where you can find resources for these things. Because I find if you're going to ask the question, you should also have knowledge of what you can do to help those families to give them resources. Next slide. So SEEK is one of the more common questionnaires that's used to assess for social determinants of health. And you can kind of read through the questions here, any environmental exposures, any issues in the home as far as, any parental violence happening, going on, as well as parental depression, stress. So you can go to the next slide. This is another screening tool too. It's called the Pearls Questionnaire. Again, looking at any kind of ACEs or the adverse childhood experiences as well. Both are similar in length and ask similar questions as well. Next slide. So as far as scoring for both of these tools, the nice part is that, any yes question is considered a positive. So that is helpful, that it's not complicated as far as doing the screening and actually scoring the tool. The nice thing is SEEK, if you could read, and Alex, if you can go back 2 slides, please. There you go. So if you look at the first part of the SEEK, it does have a very nice disclaimer when we're starting this. So as you can read there, being a parent is not easy. We want to help families have a safe environment for kids. We're asking them to complete these questionnaires. So, I find oftentimes in the office, in the busy flow of, weighing the child, getting them back, getting them undressed, ready for the exam, parents are already kind of stressed. And then when this questionnaire kind of shows up in their lap, they kind of, scratch their head and say, oh, did something I did make them, want to do this for me? But I think if we're prefacing it across the board that, all patients and all families get the same questionnaire and the same screening, it is helpful so that nobody feels singled out or we don't feel like anyone's put on the spot. So go ahead forward two slides, please.
And Dr. Work, there's a question in the chat box. Is
Okay.
there a questionnaire that includes assets, protective factors, or positive childhood experiences?
That's a great question, Beth. I do not know of one. I think that would be great to have, just as many, protective factors as we do for factors that make us more worried for the child. I think it's more dependent on us to kind of ask that from the families themselves. But That's a great one. And I will keep an eye out for that and do some searching and get in touch with Alex if I do find anything in that way. So great idea. And I mentioned, just to kind of go forward a little bit more on this, that there's been studies that looked at, whether these questions are asked verbally or if they're done on a written piece of paper. And if you look at the people are willing to answer most honestly when it is written down, that oftentimes when it's delivered verbally, that people are either feel uncomfortable sharing that information or they feel judged. And so it is actually best whether it's done written, whether like on a piece of paper or like on a tablet. Both of those have been found that parents are willing to answer most honestly. So, and then, like I said, know what to do with a positive screen because you don't want to leave those people without resources when they've been willing to open up and share what's going on in their family. And then kind of looking back to the Seek is slightly more concise than the Pearls as far as length of the questionnaire, but I would say all in all, it's a 1 page. So that can be done pretty easily in the office. Okay, so this was had mentioned to us from for ODH for immunization. So it's called the AFIX, and what it is it's not really a screening tool, but it really is a quality improvement program that was done to increase immunization coverage levels, to reduce missed opportunities for vaccination, and improve standards at the practice level. We know that post-COVID and all during the pandemic, we saw rates of immunizations really decrease. So across the state, we're really trying to bolster immunizations, especially for our primary series for our youngest children, to really help protect them as schools have opened up and things are returning more to normal. As far as kind of what is involved in the AFIX, so it has an introduction, there's an assessment period, a feedback, exchange, which is a follow-up, and then some type of incentive, which for the ODH has also included access to the MOBI and TIES program through the Ohio AAP. So next slide. So this is a little bit more specific in a graphic that explains the AFIX program specifically. So there's a pre-visit communication where they are contacted the provider to introduce the program and schedule the session. That's done by ODH. And then they complete a questionnaire at that time. And then they pull some data from Impact to see what the immunization rates are at the practice level. Then there's the assessment where the data is pulled from Impact. And then they run the coverage reports and patient lists and review the reports and questionnaire to become familiar with the information. And then they prepare the resources. And then there's a face-to-face meeting with the provider where they review the quantitative and qualitative reports and design a plan to really try to improve the immunization rates at that individual practice or provider level. And then they schedule a follow-up to see if there's been any improvement, where they pull the data again from Impact and compare to the previous data to see if there's been any improvements. And again, they use QI techniques and PDSA cycles to improve at the office level to see if there's ways to increase the immunization rates. So QI winning again. Next slide. Okay, so again, most of us can kind of see that day to day, especially post-pandemic, that teenagers are really, really struggling with mood and having a lot of depression, a lot of anxiety. And so, oftentimes instead of this, oh, by the way, to question while we're, getting ready to walk out the door of the visit, this is a more standardized way to get a better idea of, how severe depression or anxiety is in teenagers. So, the PHQ-9 is the most common instrument that's used. It's a multi-purpose instrument for screening, diagnosing, and monitoring the severity of depression. And then there's the GLAD PC, which is the guidelines for adolescent depression in primary care that recommends depression screening at all well visits starting at age 12, which some people would argue is very low. But I would argue that a lot of our pre-teenagers and young teens are struggling just as much as our older teens. Next slide. So the context for developmental screening. So according to a survey that was done through ODH in 2019 called the Ohio Youth Risk Behavior Survey. So this is even prior to the pandemic, stated that at least once in 12 months prior to this survey, 33% of high school students felt sad or hopeless almost every day for 2 weeks in a row, that they stopped doing usual activities. 15.6% of high school students seriously considered attempting suicide. 10% made a plan of how they would commit suicide. 10% experienced intimate partner violence, and 13% were bullied. So certainly these teenagers have reason to have mood symptoms and feel depressed at times. So we want to look at a little bit more closely about how we screen them in the office. So if any of you have not seen the PHQ-9 questionnaire before, this is it. So it's a 9-question questionnaire. It is pretty concise to do in the office, and you score based on not at all, several days, more than half days, and nearly every day. So when we look at this, you can see that there is scoring here at the bottom. And basically, a lot of times this is done, by the office staff with the scoring, but it's pretty easy to do. And then what you come up with is an overall composite score that gives you a range from 0 to 10 about the severity of the depression. Next slide. So you can see, so you see between none and severe as far as the depression severity. And you can see also the proposed treatment actions as well, whether you can wait and follow up at the next visit versus needing to have a more proactive treatment plan, just based on the amount of the scoring. And again, this is evidence-based and has been studied previously as well as a validated tool. Next slide. And again, just like our teenagers, our moms are also struggling with depression. And, given that they've not had as much of family support, just given the pandemic and all that has happened, it's still really important to screen our moms about any depression, especially when they're having young infants within the first, 0 to 2 months of life. So you can see the questions here. This is called the PHQ2 test. And it's over the past 2 weeks. Have you been bothered by any of the following problems? Little interest or pleasure in doing things, feeling down, depressed, or hopeless. And again, the scoring is the same with not at all, several days, more than half the days, or nearly every day. Next slide. Okay. So with the maternal depression screening, it has those first 2 questions of the PHQ-9. A positive score from maternal depression screening is 3 or greater, which the range is between 0 and 6. And it is recommended if this tool is positive to go ahead and do the full PHQ-9 screening to perform an evaluation for depression. And one thing going back to the PHQ-9 as well, that oftentimes this is also used in addition to at well child visits to use as a more objective form of evaluation when kids are coming in with a chief complaint of depression as well. And it can be used, in follow-up visits too, to assess for any objective signs of change. Next slide. So pros and cons. So the PHQ2 and the PHQ-9 are both fairly concise questionnaires. Like we mentioned before about the social determinants of health, it is best done as a written screen, whether on paper or a tablet versus asked verbally. Oftentimes that these questions, sometimes people may be embarrassed to admit that. But, if your choice is to ask it verbally versus it not getting asked at all, we would still prefer that you ask. It's super important to know what to do with a positive screen and to address that at the time of the visit. That is going to be the best way to help that family at that time to get them the resources they need. Okay, and lastly, oral health risk assessment. Okay, so the AAP again reminds us that oral health risk assessment should be performed at all 6, 9, and 12-month visits, and that parents should establish with a dental home at 12 months. Again, if parents do not establish with a dental home, we do recommend continuing to perform an oral health risk assessment at 12, 18, 24, 30, 3 years, and then 6-year visits. So next page here. Okay, and so this is one that's done through Bright Futures and the AAP. So it looks to see, different risk factors for caries and decay. So does the mom have a primary caregiver for oral health? Or has the mom had any dental decay? So that itself is a risk factor for the child actually also having cavities or dental decay. Some common things that we would think of is, continual bottle use or sippy cup use with things other than water, like milk or juice, frequent snacking, any other special healthcare needs, or kids that may have, more complex medical problems that could affect their saliva formation or otherwise. If they are Medicaid eligible. Some things which someone mentioned before, what are protective factors? So I like this screening tool because it does say that protective factors. So an existing dental home, drinking fluorinated water, fluoride varnish done at the prior visit, and then if teeth have been brushed twice a day, and then any clinical findings. So, and then the last box there at the bottom will give you kind of some things to work on for the family. You can see here, this is a more for the provider itself, but gives you some risk factors, what to look at when you're using this tool, and kind of things that you can kind of mention to the families when you counsel them about this, as well as the protective factors. And then and then again, it also gives you some pictures to help identify things as far as oral hygiene and things that you may be worried about when we are looking at the child. So I thought it was a pretty complete tool, and nice that it has some pictures. And then, these pictures are something that you can also point out to families so they're aware of what we're looking at as well. So next slide. Okay, so we went through a ton faster than I thought we would even. So, so again, this gives us some opportunity for some chats and maybe even just kind of a good discussion. If what you guys have used in the office that you think has worked well, or things that you think there's room to improve in this space.
And if you would like to type in the chat box, you're welcome to, or you can unmute and turn your camera on if you want. No pressure to have this discussion. And I know that Beth had put in the chat box too that she wondered if Pace Connection has any of those resources that are available.
I can't speak to the Pace Connection. I don't know for sure. I'm not familiar with that program, but if someone is, feel free to unmute and speak up about that.
This is Beth, and Pace Connection is just it has both. It's a national organization that is working on ACEs and PCE, positive childhood experiences, and it just has a wealth of resources that people can use. So that was just my comment. I wonder if they have any resources on some screening tools that also include assets or positive childhood experiences.
And Marie said that she's used the adult PHQ-9, but not the child one. I would say the questions should be pretty identical. And for most of the kids 12 and up, those are ones that, they could also relate to and answer honestly in that way too. So that is nice that there can be some overlap there. Anyone else have anything to share? Any discussions? We really appreciate your time. We appreciate you guys taking the time in the office to do this every day, because it is important and it does allow us to gain some more information about our patients and families. But again, we'll keep kind of looking at this. We know these things are getting updated and changing all the time. So certainly we'll send some information if we do find anything in the next few weeks about some questionnaires that may have some of the protective factors or positive experiences. That's a great idea to look into.
Great. Well, thank you, Dr. Warwick. If there's not any questions during this time, I will, let's see, a few more things. We can send the tools. I will send this PowerPoint, and I can send a link to the tools as well. And then thank you, Beth, for putting that in the chat box. Great. Well, thank you again, Dr. Warwick, and thank you, ODH, for your support with this program and this training. If you all have any questions that come up after the training, please feel free to email me and I will make sure Dr. Warwick gets those. She also has a list of resources here, and these will be included in the PowerPoint that I send out. And then we also created new resources from this training. So these are on the website and you are welcome to use those. And we will, all the resources from the other previous trainings are on the website as well. And let's see what else I have. And then if you have any questions, please email me. Please go to our website to access those resources and register for our next training. We have 2 left after this one. Thank you so much, Dr. Warwick, and thank you all for attending on a Friday during your lunch hours. So we're glad to have you, and we hope that you all have a great weekend, and we will talk soon. You all.